People are actually now suffering the consequences of deferred medical care. My name is Stephen Giannotta. I'm the chairman of the Department of Neurological Surgery at Keck School of Medicine, USC, and that's in Los Angeles. The consequences of the delayed care obviously vary. They thought that just by telling the hospitals, don't do any elective cases, don't give any elective care, that somehow all those patients would remain well. People are actually now suffering the consequences of deferred medical care. One of our very excellent neurosurgical nurses was just here in my office telling me about how difficult it is for her to get some of our patients to come to the hospital. A young, healthy gentleman came into the hospital, brought in by his friend because he was going paralyzed in his legs. We found out that he had a tumor compressing his spinal cord. We removed the tumor and his paralysis went away. He was discharged from the hospital. Unfortunately, the tumor was cancer. And so we had scheduled him to come back for cancer care. And unfortunately, his family, because of their fear of COVID positivity, talked him into not going in to see us. As a result, he ends up many months later coming back as an emergency because he can't breathe because he's got metastatic cancer all over his lungs. My team here at Keck deals with a lot of stroke patients, and we're seeing a 40% reduction in patients coming to the hospital with stroke symptoms. And we're finding out that they are so afraid to go access the healthcare system because of fear of COVID positivity that they tolerate their warning symptoms of stroke. And obviously the mortality rate of a cardiac arrest that occurs at home is dramatically higher. It highlights the fact that the hospitals and the healthcare systems have been stigmatized because of the possibility of becoming COVID positive. We've got to reinforce the fact that COVID positivity is not a death sentence. My name is Stephen Giannotta from Keck School of Medicine, Department of Neurosurgery, and this is my second opinion.